Exhaustion, sadness, stress, anger. That's how one Valley nurse describes working inside one of the busiest COVID-19 units in Phoenix. And she's opening up to share her truth with our community. Only ABC 15 Sonu Wasu with the eye-opening interview.
I never ever want to get this virus, and I don't wish this on anybody.
Almost 20 years working in an intensive care unit, nurses like Debra are used to seeing pain and suffering. She asked us not to disclose her last name or the hospital she works in, but Debra says what they're witnessing now with COVID-19,
it's intense, it's very stressful, very, very challenging. I never would have guessed that this would have happened in my career.
In March, Debra's unit turned into one of the first COVID-19 units in Arizona.
At that time, I think we had about 8 patients. Now we're full, we're overflowing into other units, and they're filling up, and it's extremely difficult. It's challenging.
Debra says seeing the amount of tubes, machines, and IV medications attached to patients seemed barbaric.
What kind of emotional toll is this taking on you and your colleagues?
It hurts to see how hard we're trying, and sometimes it's not enough. I don't want to I've seen some amazing people on my team break down, and we all understand, and we're all just there to try to help each other through it.
She tries to put into words the suffering she sees.
They cannot breathe. They're struggling to get comfortable. I don't know if you've ever felt like you cannot get your breath. You cannot catch that breath. That anxiety that goes with it.
Debra says she wants to speak out because she knows numbers, charts, and graphs can be hard for people to understand. What's happening inside these hospitals is very real.
The last night that I worked, we had 1 COVID bed available. There are other intensive care unit beds, but those are, people are still having car accidents, heart attacks, strokes, things like that.
In a letter to her community, Debra writes, they're doing everything they possibly can to save patients' lives. She also says they desperately need more hands on deck.
How emotionally exhausting is this work right now?
It's extremely emotionally exhausting. We're going through every gamut of emotions you can imagine.
Nurses like Debra are also doing the job of comforting a patient in the last moments of their life. Some hospitals are now allowing families in to say goodbye, but in many cases, a nurse is the last person a patient sees.
We never let them pass alone. One of us is always at least in the room when they do pass away. But I've definitely prayed over patients.
Debra tells us people are dying that should not be dying. The disease is horrible. It does not discriminate. She's seeing more 20 and 30-year-olds coming into her unit than before. And now that hospitals have been told to go into emergency mode, they are preparing for things to get worse. The reason she wants to tell her story is to send a message to the community.
There's always later. You can always go to that bar later. You can go take that trip later. The smartest thing right now to do is just to stay safe, be considerate,
Be safe and be smart. Debra says it's much easier than becoming a patient or watching a loved one suffer in the future. In Phoenix, Sonu Wasu, ABC 15, Arizona.